The American Heart Association is the nation's oldest and largest voluntary organization dedicated to fighting heart disease and stroke. America's #1 and #5 killers. Innovative life-saving procedures, like the ones performed by Dr. Mustafa Ahmed and Dr. Clifton Lewis at Princeton Baptist Medical Center, are funded and researched at their beginning stages by the American Heart Association.
A leaky mitral valve from something like mitral valve prolapse. For years, open heart surgery was the only option. But what's interesting is 1/3 of patients were denied an operation. They were just not being operated on because they were felt to be too high risk, because you're not going to make it through the trauma of having your chest cut open. We would now go through the leg on those patients. This is a procedure which can take just an hour long. You can advance a valve up to the heart. You can place a new valve, and this patient can go home in less than 48 hours. That patient clearly has benefited from a minimally invasive strategy.
This is designed for people who are at exorbitant risk or high prohibitive risk for conventional surgery. And in that population, it is like somebody flipped a switch and everything changed in a day. This is one of the biggest advances in cardiac surgery in my professional lifetime.
Funding and research for these procedures is made possible through events like the annual Birmingham Heart Walk, the American Heart Association's premier campaign for raising funds and awareness for heart disease. Designed to promote physical activity and heart-healthy living, the Birmingham Heart Walk and other American Heart Association campaigns have helped us fund more than $3.8 billion in heart disease and stroke research, more than any organization outside the federal government. Through events like the Heart Walk, we're able to fund innovative research, fight for stronger public health policies, and provide critical tools and information to save and improve lives.
I could hardly walk to my mailbox and back. I was constantly in the hospital because my heart rate would go so high.
An open heart operation would have been traumatic. And that's when we sat down and thought, this is what the minimally invasive procedure is designed for. We did the procedure and the valve was fixed. But not only that next morning she was up and about, and she went home the next day.
Drove myself to church, sang in the choir. I've been able to do almost anything since.
Miss Summerford would have been one of those patients who may not have had an option if this minimally invasive technique wasn't available.
The American Heart Association works to improve the lives of all Americans by providing public health education in a variety of ways, including providing science-based treatment guidelines to healthcare professionals to help them provide quality care to their patients, and educating lawmakers, policymakers, and the public as they advocate for changes to protect and improve the health of our communities. As a leader in public health education and science, we train more than 13 million people a year in CPR, certify companies to be fit-friendly workplaces, and engage thousands of elementary school-age children in programs like Jump Rope for Heart. Science also remains at the core of the American Heart Association. Cardiovascular research, funded and performed thanks to the American Heart Association, has saved thousands of lives and has given hope to those suffering from debilitating and life-threatening diseases. By the year 2020, we hope to improve the cardiovascular health of all Americans by 20% with programs like these, and reduce deaths from cardiovascular diseases and stroke by 20%. Fundraising events like the Birmingham Heart Walk can make an impactful difference not only in the lives of healthcare professionals like Dr. Ahmed, but also in the lives of survivors like Betty. Supporting the industry-leading research and educational work of the American Heart Association allows for additional patients to fight or avoid cardiovascular diseases, living a healthy, fruitful life. You can help save the lives of people just like Betty by committing your company to participating in this year's Birmingham Heart Walk today. It's a decision that will not only help your organization, but the surrounding local community as well.